Hi, I'm Dr. Chantel Walker. I'm a pediatrician with Franciscan Health, and today I'm here to discuss two things you should know to keep your baby safe during sleep. Did you know that in Indiana, 52% of deaths occurred while infants were sleeping in adult beds? Bed sharing with at least one adult accounted for 51% of total deaths. 12% of deaths occurred on couches, futons, or chairs. For 75% of total deaths, a crib or bassinet was available in the home. Some of the hazards associated with co-sleeping include suffocation, entrapment, airway obstruction, and strangulation. The American Academy of Pediatrics recommends against bed sharing with full-term, normal weight infants younger than 4 months. It may be easier to co-sleep when breastfeeding, but it is not safe. When you are asleep, you cannot control your body moving. An infant can get wedged between the headboard and pillow, or the parent might accidentally shift while sleeping. It's okay for a parent or parents to share a room with the new baby, but not a bed. When you are in a deep sleep and next to your infant, you are not able to say, "I won't roll over on them." I think new parents are most surprised about how important it is for infants, newborns, to sleep by themselves and not to co-sleep. I think that they've imagined that we will have a better bond if we're all together, not realizing the dangers and at the risk that they're putting the infants in. Unfortunately, I've had two families during my tenure that have had infants pass because they were co-sleeping and the parents rolled over and the baby suffocated, and that is an awful, terrible thing for anyone to experience. So it's so important for infants to sleep in their own crib or bassinet or pack and play on their back and not co-sleep with the parents. Did you know that the size of your baby's airway, which takes oxygen to their lungs, is smaller than most straws? A baby's airway is the size of a cocktail straw, meaning even small obstructions can easily block their breathing. A baby's airway is significantly smaller than most straws, making them more vulnerable to breathing difficulties, particularly during sleep, especially when they are under 4 months old, which increases their risk of sleep-related death. Infants under 4 months old have underdeveloped muscle control in their airway, making them more susceptible to breathing disruptions during sleep. This small airway size is a contributing factor to sudden infant death syndrome, SIDS, which is why safe sleep practices are crucial for young babies. Put your baby on their back for all naps and at night. Use a firm, flat sleep surface. Never sleep with your baby. Instead of bed sharing, room share with your baby. Keep soft objects and loose bedding out of your baby's sleep area. Do not let your baby get overheated. Consult your pediatrician if you have concerns about your baby's breathing.